Hi champs, let us discuss about one more important condition of medical surgical nursing, that is hypothyroidism. As you may know, the word hypo tells us that there is a deficiency or under secretion of which hormone? Of thyroid hormone. We have a gland, butterfly shaped gland near the trachea, which is termed as thyroid. It secretes three important hormones, that is T3, T4 and calcitonin. So this thyroid hormone is responsible for the basic metabolism in our body. So if there is a deficiency of thyroid hormone, that results in slowed metabolic rate. It is a definition of hypothyroidism. It is a deficiency of thyroid hormone resulting in slowed basal metabolism, decreased heat production and increased oxygen consumption by the tissues. So usually you can see a high underactive thyroid gland where there is a deficiency of thyroid hormone, because of which metabolism will be slowed. As metabolism is slowed, heat production also will be decreased and oxygen consumption by the tissues also will be increased. So this underactivity can be either because of, primarily the problem may be associated with thyroid gland, or secondary to any other disease conditions which may cause this hypothyroidism. So it can be of primary form or secondary form, because anterior pituitary will be releasing thyroid stimulating hormone. It secretes TSH, which will go and stimulate the thyroid gland to release T3, T4 or calcitonin. So if enough amount of TSH is not secreted by the anterior pituitary gland, or enough amount of TRH, thyrotropin releasing hormone from the hypothalamus, any of these deficiencies also may result in hypothyroidism. So in those conditions we term that as secondary hypothyroidism. So this hypothyroidism, if it is not identified or if it is not treated properly, this may lead to a life-threatening condition called myxedema coma, where all the body systems may get severely compromised because of the hypometabolic state. So severe compromise of all the body systems will happen in this condition, which is a life-threatening condition. This happens if hypothyroidism is not treated properly. So the name of that life-threatening condition is myxedema coma. Incidence, all of thyroid disorders, if you see gender wise incidence, it is more commonly seen among females compared to males. So here hypothyroidism, if you take the ratio of female to male ratio, it is 4:1. Highest incidence is seen among adults between 30 and 65 years of age, and about 95% of all the people with hypothyroidism have primary form of disease. That is, primarily the problem may be associated with thyroid gland, it may not be associated with pituitary gland or hypothalamus. Primarily 95% of hypothyroid disorder patients may have problem associated with thyroid gland itself. Etiology. So there is an association of iodine deficiency with thyroid disorders. Iodine deficiency in the diet, inflammatory processes where thyroid gland may get damaged, self-destruction may happen. We have some conditions like Hashimoto's thyroiditis, where inflammatory processes will destroy the thyroid gland. Complete or partial removal of thyroid gland. This happens in case of hyperthyroidism, or if any cancerous condition where they have treated by removing adjacent parts. Along with that, if thyroid gland is being removed, then that may also result in hypothyroidism. Unfavorable environmental factors, if they are exposed to any radioactive radiations or they are working in a harmful climatic situations, then that may also result in hypothyroidism. Any anomalies when the baby in the fetal life itself, if any anomalies have been encountered in the endocrine systems, that may also result in hypothyroidism. Any drugs, any pharmacotherapies, any drugs they are taking for any other conditions which may be considered as goitrogenic substances, which may have an influence in damaging the thyroid cells, that may also lead to deficiency of thyroid hormones. Let's see the types of hypothyroidism. Commonly, you have four types: primary, secondary, tertiary or central, and subclinical. So, primary, as already I have told you, that it is a form of disease where the thyroid gland dysfunctioning is the problem here. So, here TH levels, thyroid hormone levels are low and TSH levels are elevated. That means anterior pituitary is trying to stimulate the thyroid gland to release thyroid hormones, but even though with the stimulation thyroid gland is not responding to that. So that is TH levels are low here, TSH levels are elevated, indicating that the pituitary is attempting to stimulate the secretion of thyroid hormones, but the thyroid is not responding properly. While secondary, it develops where there is insufficient stimulation of a normal thyroid gland. TSH levels are decreased. This starts as malfunction of pituitary or hypothalamus. So it can be associated with pituitary or hypothalamus malfunctioning where thyroid gland is normal but enough TSH is not secreted by the anterior pituitary, and that results in low thyroid hormone levels. While tertiary or central hypothyroidism, where hypothalamus will not be producing enough amount of thyrotropin releasing hormone. As a result, TRH is not in enough amounts. When TRH is not in enough amounts, it will not stimulate the anterior pituitary to release TSH. If TSH is not released, it may not stimulate the thyroid gland. So as a result, both TSH as well as TH levels are low here. Then what do you mean by subclinical? That means under, sub is under, a subclinical hypothyroidism. It is found in 20 to 120 people among 1000 people in the community. It is defined as one form of hypothyroidism where there will be an elevated TSH level but normal to low normal level of T4 levels can be seen. That means it is not coming in any of these primary, secondary, tertiary category. Elevation in the TSH will be seen and there will be a normal to low normal levels of T4 level. So that category we term here as subclinical hypothyroidism. So what is the effect? It is the pathophysiological change. So either because of deficiency of iodine or because of any of those disease conditions or exposure to chemical substances, radiation and all, there will be decreased secretion of thyroid hormones. That results in hypothyroidism. When hypothyroidism is happening, it obviously slows the basal metabolic rate. This also results in achlorhydria, absence of hydrochloric acid in the digestive juices, decreased GI motility, bradycardia, slowed neurological functioning, decreased heat production, increased serum cholesterol, triglyceride levels, which finally results in coronary artery diseases. So clinical features: you have mild condition which is more common, which is an asymptomatic condition. Some way clinical features will be seen in this condition like cold, lethargy, dry skin, forgetfulness, depression, some weight gain, like that mild symptoms. While mixed edema, it may develop in clients with undiagnosed or undertreated hypothyroidism that experiences. That means if people with this hypothyroidism are experiencing any infection, any drug usage, or any stressful situations like heart failure, trauma, in those situations the aggravation of this condition may be seen. Usually edema which is of non-pitting type is seen here. This is more commonly seen in facial areas. Also they may have hypercholesterolemia, hyperlipidemia and proteinemia. So one more severe complication which already we have discussed in the beginning, that is mixed edema coma. It is an extremely rare condition, but if it happens, 100% of mortality rate is for sure. So there will be drastic decrease in the metabolic rate, hypoventilation leading to respiratory acidosis, hypothermia as well as hypotension. The complicating conditions in this may include hyponatremia, hypercalcemia and water intoxication. So all these are associated with drastic slowed basal metabolic rate. Diagnosis: just by blood investigation, blood test where thyroid hormone assessment can be done, and from that we can know if there is any deficiency of T3, T4 or even TSH levels. Medical management: so there is no need of patient being admitted for such a condition, because this can be treated by replacement of thyroid hormone, as deficiency of hormone is the problem here. So this is done in OP basis. Usually the treatment is ongoing process and it is a lifelong process, because throughout their continuation of therapy is needed here. Clients with myxedema or myxedema coma usually are considered as emergency patients and they have to be treated in the hospital. Desired outcome is mainly to correct the thyroid hormone deficiency, to reverse the manifestations, and to prevent further cardiac and arterial damage, which I have already told you in that pathophysiology, where atherosclerosis, hyperlipidemia, and all will happen that results in heart problems. So we have to prevent such. So the simple management is by administering levothyroxine sodium, that is available in a tablet form. It can be administered, it can be useful even in children and older adults. This can be given, but in small doses. And as far dietary management is important, pharmacological goitrogens also must be changed, which may interfere the functioning of thyroid gland. Usually after taking this medication, improvement can be seen within 2 to 3 weeks. While in case of myxedema coma, as we have discussed, they have to be treated in the hospital. The desired outcome is mainly to reverse the condition of to save the life of the patient. Here we can just provide with supportive measures to maintain a patent airway, for administering oxygen, and to replace fluids intravenously. So that levothyroxine sodium can be administered here intravenously along with glucose and corticosteroids. We have to assess very carefully to those patients who are already diagnosed with any cardiac problems. When administering thyroid hormone, we have to assess for angina, dyspnea, or even orthopnea. And we have to make sure that the client is kept warm, and we have to closely monitor the vital signs. Dietary management is very important. In case of hypothyroidism, there are many foods they have to be avoiding and foods which they can include in their diet. That's it, guys. Thank you.